Hi, this is Dr. Doreste with the Cranial Release Technique, and I wanted to just cover some what I consider to be an interesting topic. Emails constantly come into me asking me, is cranial release good for this problem or that problem or this problem or that problem? And so I just wanted to address this concept of who would benefit from seeing a cranial release practitioner and receiving the cranial release technique. And of course, the simple answer in my mind is, well, everyone would benefit. But let me explain what I mean. Unlike most types of practitioners that you would visit, unless you're going in the holistic world, the cranial release technique practitioner and the practice of CRT is not designed to treat symptoms, diseases, syndromes, anything like that. Our philosophy, our understanding is that the body is a self-healing organism. There is an inborn intelligence in all living things that does its best to keep us happy, healthy, and thriving, not just surviving. In the human beings, it's a known medical fact that the brain and spinal cord, commonly called the central nervous system, controls and coordinates every function of the body. So, if you go to Gray's Anatomy, the first thing we learned in chiropractic school, the central nervous system controls and coordinates all functions in the body. So now we have the brain, which is covered by these 22 cranial bones called the skull or the cranium or the head. And these bones can shift out of their normal position. And that can happen from many things. Traumas, slips, falls, car accidents. In other videos and in some future videos, I'll speak about the birth process itself and how the birth process, as the baby's head passes through mommy's birth canal, that in itself can misalign the cranium. So we have physical stresses, we have chemical stresses, we have emotional stresses, and if you've been following my videos, we have these EMF or electromagnetic frequency stresses. All these things can disrupt the normal alignment of the 22 cranial bones. Those 22 cranial bones remain separate because throughout life they need to move. So if you can imagine these bones moving, which is normal, which is natural, and now if they shift out of position from the stresses that we just discussed, that movement is reduced, is labored, is hindered, is stressed, whatever word you're comfortable with. Now with mechanical, actual physical mechanical tension on the central nervous system, in my mind, the body is now going to function at a weaker level, and you are more susceptible for all the things that people call me about. Can cranial release help with this or with that or this thing or that thing? So rather than chase the this or the that or the other thing, which is basically what the other guys do, the medical profession, and they're very good at it, I want to get to what I consider the underlying cause, the root cause that no one's really looking at, which is how do I help the central nervous system, since it controls and coordinates all functions in the body, how can I help the central nervous system to optimize, to function better at a higher level? And of course, the answer to that, in my mind, is the cranial release technique. For more information, you can visit our website at cranialrelease.com. If you're a practitioner and would like to learn more about how can you learn this technique called the cranial release technique, which is a 1-minute hands-on technique. So my hands are physically on the patient's skull, doing a very particular technique to help open, balance, and restore this movement back to the cranium, and then optimize function throughout the body For a practitioner, you can learn this work by, again, visiting cranialrelease.com, clicking on the button that says Online Training Program, and that will take you to more information about how you can learn this work. Again, Dr. Doreste, the cranial release technique, cranialrelease.com. Thank you so much. Have a fabulous day. Goodbye.